This is a whole different level to anything we've seen before. They're wearing super advanced masks, much nearer to a gas mask than we normally see our hospital staff wearing.
President Trump, with top public health experts delivering a grim forecast for the coronavirus pandemic now gripping the country.
I want every American to be prepared for the hard days that lie ahead. We're going to go through a very tough 2 weeks. This is going to be a very painful, very painful 2 weeks.
The White House displaying this stunning slide, showing even if current social distancing guidelines are maintained, the White House projects 100,000 to 240,000 deaths in the U.S. over the next several months.
Tonight, with most of the nation, roughly 3 in every 4 Americans, being told to stay at home, our country has reached another grim milestone. Over 3,600 lives lost in a battle just beginning. States big and small reporting a steady rise in confirmed cases of the coronavirus. New York accounting for many of the deaths, where the healthcare system is overrun and undermanned.
We are planning now for the battle at the top of the mountain. That's what we are doing. We're gathering equipment that we don't need today because today is not the day of the battle.
As New York prepares for another surge in patients, the call for help stretches far beyond the Empire State. Aboard the USS Theodore Roosevelt, the commanding officer says his entire crew, more than 5,000 sailors, need to be isolated after more than 100 tested positive for the coronavirus.
COVID-19 outbreak has strained global airlines to the brink. And in the United States, major carriers are scrambling to react to the unfolding pandemic.
We've seen a dramatic drop in demand that really the industry hasn't seen since 9/11.
The next few months will be ugly for the travel industry in terms of both demand and their financial performance.
The initial coronavirus outbreak caused a massive drop in air travel inside of China between January and February. As the virus has spread, both vacationers and business travelers have curbed their plans. And on March 11, 2020, President Trump announced that travel from parts of Europe to the US would be halted for 30 days, which later expanded to include Ireland and the UK. Airlines around the world scrambled to find a way to survive without passengers.
There have been discussions about whether to tell people not to fly.
It's the worst crisis to hit the air travel industry since the 9/11 terror attacks. Delta Airlines has cut its capacity by 70%. United Airlines has cut 65% of its capacity, and American Airlines has cut 50% of its capacity.
When an airline says they're going to cut capacity, that means they're going to cancel some flights. And that could be canceling frequencies in a route that has lots of frequencies in it, or it could mean stopping flying between 2 cities they've been flying before. Airlines talk about capacity as the number of seats they have in the air at any time, or really the number of seats they have out for sale at any time.
Internationally, Norwegian, SAS, and Lufthansa have suspended most of their operations, and more cutbacks are expected from other airlines.
The demand picture is worse than after 9/11, and we have no visibility as to when things are going to recover. On the range of possibilities, sure, there's a scenario where a couple months from now, maybe coronavirus isn't eradicated, but things are more stable, and health authorities are changing their advice, and people are willing to get back on airplanes. But that at this point is the most optimistic scenario. Months of disruption.
The U.S. Senate just reached a deal on a massive $2 trillion relief package to help with industries and individuals hit by the coronavirus pandemic. The airlines wanted $58 billion from the package, and the exact details on what ended up in the deal remain vague. What we do know now is that airlines won't be able to buy back stock or hand out bonuses to CEOs as part of the deal. And they won't need to pay back the direct cash grants they receive, though the government will take an equity share. The airlines must also agree to refrain from layoffs until later in
spike in cases in California. LA's mayor predicting this could be the week of a massive surge. Governor Gavin Newsom, like so many others, in desperate need of ventilators. He says 170 arrived broken in a recent shipment. Governor Newsom telling us the state is now reaching out to famous billionaires for help.
Major cities in America bracing for that onslaught of patients. In California, the number of ICU patients more than doubling over the past 48 hours. The number of cases surging in the nation's most populous state past 5,000, along with the lag time in test results.
Average right now of our commercial labs, 7 days yesterday. Average. We're seeing some as many as 12 days. That's unacceptable.
Los Angeles, the epicenter, with more than 1,800 cases and more than 30 deaths. The mayor warning LA could look like New York within days. Here in Silicon Valley, a Herculean effort to get mothballed ventilators from the federal government stockpile up and running.
This hive of activity you see behind me, every one of these technicians is actually fixing one of these faulty ventilators.
The governor calling in every favor to secure protective gear.
Where are you sourcing 101
All around
million?
the world. I mean, quite literally.
And how
all
are you
around
getting
the
them here? Because everybody's having supply
all around
chain
the world. I
problems.
mean, we got Richard Branson taking a 747 from Hong Kong coming into the Bay Area. We've got Elon Musk that was able to get 1,200 ventilators for us in 72 hours from overseas. I've already distributed 31.7 million N95 masks just in the state. I ordered, not making this up, we have on order. We wrote a check for 101 million.
At the start of the crisis, the federal stockpile only had 13 million such masks. Texas tonight reporting a dramatic spike in cases, 500 in the last 24 hours. The governor announcing major travel restrictions for anyone arriving from several cities, including New York, New Orleans, and Miami. And Washington, the first state to grapple with the growing number of dead, still without sufficient supplies.
We have a desperate need for the testing kits. We have got to mobilize the entire manufacturing base of the United States, like we did in World War II, for things as simple as these testing kits.
And tonight, the Army brought in to convert the cavernous convention center outside Seahawks Stadium, normally home to car shows, into an overflow hospital.
Tonight, a doctor taking us inside New York's Mount Sinai Queens Hospital, now pushed to the brink.
This is our ED. You can see all the rooms are filled. Usually these halls are very neat and empty. And now you can see there's patients everywhere because of this. It makes it very hard to work, and we're trying our best to treat everyone that we can.
Many of the patients immediately put on oxygen.
All these patients here sitting out in the hallways because we are full.
Healthcare workers on the front lines making painful sacrifices.
I said goodbye to my wife and my daughter for who knows how long. It's going to be several weeks probably before I see them in person again.
Everyone in the hospital is working overtime, and it takes a toll because you're both physically and mentally exhausted.
And tonight, news on Dr. Colleen Smith, who shared these images from one of the first hard-hit ERs in Queens.
All the patients in this room, all the feet that you see, they all have COVID.
Now confirming she's tested positive herself for COVID-19. Hospitals so overwhelmed, iconic public spaces now used to treat patients.
This is really an extraordinary moment here. You can see that ambulance pulling up behind me. We're told that this is the very first patient with COVID-19 to be transported and then treated here at this field hospital in the middle of Central Park.
This facility has 68 beds. Medical teams and volunteers from Samaritan's Purse stepping up to meet the need.
Some will be transferring who are already ventilated, and so we will then transfer to our ventilators to take care of them.
The death toll in New York State close to 2,000, surging by nearly 400 overnight. One projection showing 16,000 New Yorkers could die. And tonight, word of the youngest known victim, a 6-week-old baby, passing away from complications of the virus in nearby Connecticut.
Biblical. I kid you not. People come in, they get intubated, they die, the cycle repeats. 9/11 was nothing compared to this. We were open waiting for patients to come who never came. Okay? Now they just keep coming. And they're all ages. Don't delude yourself into thinking only the old will die or will get it. They're all ages.
A sea of people amidst the coronavirus pandemic. Hundreds and thousands of migrants desperate to reach their homes in rural India. They converged at a bus terminal in Delhi as the state of Uttar Pradesh sealed its borders. The police force overwhelmed by the crowds. The surge of people forced the government to arrange thousands of buses to take them back home. Men, women and children have walked for many miles, crossing state after state in a lockdown.
परेशानी है, छोटा बच्चा, खाने कुछ नहीं। हम इन बदायूं में जाएंगे, पैदल ही चल पड़े हम।
There is no social distancing or protection for these poor daily wage earners and contract workers. This informal sector forms almost 80% of India's workforce.
सर हम यहाँ पे दिहाड़ी मजदूरी करते थे, काम बंद हो गया हम लोगों का, अब खाने के लिए भी पैसे नहीं है और पॉकेट में 100-200 रुपए पड़े हुए हैं, अभी कैसे गाँव पहुँचेंगे ये भी मुश्किल की बात है.
The government failed to factor in such a rush while locking the country for 21 days, giving just 4 hours of advance notice. Police have beaten, seized vehicles and even threatened jail sentences for those defying the restrictions. Here in Delhi, the national capital, the borders have been sealed and police have put up barricades checking everyone's identity card. Only those involved in essential services are allowed to be on the road. Chris, Paula and Mandy from Derbyshire are caught in the lockdown on their dream holiday. Having spent a night on the streets, they are urging the government to help them get back home to the UK.
We've been totally abandoned here.
Being ridiculous. I mean,
totally left us.
It's laughable. We do feel that people are, I mean, they're sympathetic, but it's just like, what on earth is your government doing for you? Just like, nothing. They're not doing anything for us.
In a country where medical facilities are inadequate and social distancing measures are clearly being ignored through desperate attempts to escape, the virus has a potential to spread like wildfire here. India needs...
Difficult days are ahead for our nation. We're going to have a couple of weeks, starting pretty much now, but especially a few days from now, that are going to be horrific.
At least 45 states now with stay-at-home orders, but tonight growing pressure on the rest. In Florida, the governor reversing course, now issuing a statewide stay-at-home order for its 21 million residents. The governor abandoning his county-by-county approach after consulting with the White House.
I'm going to be doing an executive order today directing all Floridians to limit movements and personal interactions outside the home.
In Louisiana, a jump in cases. Nearly a third of hospitalized patients are on ventilators.
Those numbers are staggering, and looks like there's no end in sight. And if these numbers continue, we will be maxed out at hospitals and ventilators by the end of the weekend.
Just last night, congregants flocking to this church, defying bans on social gatherings. But Vice President Pence today telling our Byron Pitts he had a message for the faithful.
We really believe this is a time when people should avoid gatherings of more than 10 people. And so we continue to urge churches around America to heed to that.
Across the country, field hospitals going up from Massachusetts to Illinois. And in Seattle, this exhibition hall, soon to be a 250-bed hospital, complete with 2 operating rooms. But tonight, the mounting loss of life is taking its toll. 34-year-old Scott Blanks from Whittier.